Can everyone hear me? Can you hear me now?
Yes. Yes.
Okay, thank you so much. Good afternoon, everyone. Excuse me. Yesterday, the South Carolina Department of Public Health, or DPH, updated the number of confirmed measles cases in 2025 in South Carolina to 23 since July. 20 of those are directly linked to an ongoing outbreak, primarily focused in Spartanburg County. Of the 4 new cases identified since the previous update on Friday, 2 are among individuals who were close contacts to known cases, and none were present in any school settings while contagious. Because these individuals were quarantining at home before they became infectious, no additional exposures occurred with these new cases. The other 2 confirmed cases were associated with a business in Spartanburg. And through our investigation, we learned that no public exposures occurred as a result of those cases. So far in this outbreak, early quarantining as a result of the identified exposures has been successful in public health prevention of additional cases. Yesterday, the exclusionary period for Global Academy School ended for students exposed in the school setting. And today, the exclusionary period for the Fair Forest Elementary School ends. That represents all the students DPH has identified as under exclusion requirements for school exposure at this time. Students who are not ill and have not had additional exposures are able to return to school. But we continue to be concerned that ongoing community transmission of measles may occur because declining vaccination coverage puts all populations at risk, especially for measles, which is so highly contagious, and especially in congregate settings like schools. To address this, we are continuing to deploy DPH's mobile health units to provide MMR vaccines to those who have not been vaccinated. The locations are posted online on our measles outbreak page and were provided in yesterday's briefing. We will post locations to the following week as part of our regular Friday updates. Last week, DPH staff administered 7 doses of the MMR vaccine to the public on our mobile health unit, and we continue to encourage those who are unvaccinated to take advantage of this no-cost opportunity to prevent contracting measles and its possible complications. Increasing protection from the vaccine prevents spread in the community. It protects those who cannot be vaccinated and avoids disruptions to work and school schedules. The MMR vaccine, by providing lifelong immunity to the majority of those vaccinated, will help us contain this virus. And for this reason, we're urging those who are not vaccinated to consider getting that protection now. In closing, I want to remind everyone that DPH's 2025 measles outbreak page is the best place for the latest confirmed information about this ongoing outbreak. It includes data, charts, links, and resources that the media and the public need to know about measles. And with those remarks, I'll go ahead and take questions that you may have. Thank you.
Thank you so much, Dr. Bell. We'll now open it up for your questions. If you could, please raise your virtual hands, and I'll call on you in the order in which it was raised. If you can, also please state your name and the outlet that you represent when I call on you. And I ask that you hold any follow-up questions until after everyone else has had the opportunity to ask a question first. And with that having been said, Tom, go ahead, sir.
I was just asking if I was unmuted, apparently not. Dr. Bell, 7 vaccinations over the clinics that you have had to this point doesn't seem like a lot. Is that a little, I guess, disappointing considering this resource has been made available in Spartanburg County?
It is disappointing. We hope for a much higher acceptance of this service to get our vaccination coverage up. And so we do hope that more people will take advantage of this option moving forward.
Thank you.
Ray, go ahead with your question.
Hey, Dr. Bell, good to hear from you again. I know you all have been talking a lot about quarantining and the early quarantining procedures. Can you just go into the process of how DPH notifies people that they are close contact and how quarantining has been so successful in preventing spread?
Of course. What happens with our investigations when we are notified of either a suspect or a confirmed case is that we interview the individual who's suspected or confirmed to have measles. If it's a child, we'll interview the parents to learn about their activities so that we can identify anyone who's potentially exposed directly to that individual or who's been in a shared airspace with that person. And what we do is we make notifications to those who are identified as being potentially exposed. Through the schools, the exposures that occurred in the schools, we worked with school officials. We provided a guidance about the recommendations for quarantine and asked the schools to help us distribute those. We do two things. We send a letter to an entire school community letting them know that a case has occurred in that school setting. And then in addition to that, those that we have identified as being potentially exposed, those are the ones who get the recommendations to quarantine for a period of 21 days after the exposure. We also, if exposures occur in other settings, we give a similar communication providing guidance about the need to quarantine to prevent exposure to others while during that 21-day period when they may become ill.
Thank you for that question. Debbie, go ahead with your question.
Hi, Dr. Bell. Devi Shastri from the AP. I'm wondering if you could confirm that at the highest point of the students being quarantined from those two schools, how many students were quarantined in total at the highest point?
I don't have that figure in front of me, and I'll give you a reason because we actually had to adjust the number when through further investigation, we learned that some of those initially recommended to be excluded. We confirmed their vaccination history, so we did reduce that a bit. And that for that reason, I can't give the exact number now, but we will follow up with you and get you the maximum number of students who were excluded because they were not immune.
Okay, thank you.
Sure, Debbie. Lauren, go ahead with your question.
Hi, Dr. Bell. This is Lauren Miller with WSPA News. Thank you so much. I wanted to ask, when it comes to students who are quarantining, what is the protocol within the school when they come back to school? Are they put in a separate classroom or are they welcomed back into that classroom with the other students?
Once those students have completed the quarantine period for a previously identified exposure and they've not become ill, they can return to the school and just resume normal activities. They don't need to be cohorted or excluded in any other way from the normal student body. So the return to school is dependent on them not having any illness and also not having an additional exposure during the quarantine period. What we have recognized is sometimes that with siblings, household transmission can actually occur. And so some of these students may have had an additional exposure during their quarantine period to a sibling who was who became ill, and so there can be ongoing household transmission. If they're not ill and they have not had an additional exposure, they can return to the school setting without any further restrictions.
Thank you for that question. And I think I see one in the chat. This is from Thomas Moore. Has the vaccination rate at either of the Spartanburg schools increased at all?
So we are monitoring the doses administered on our mobile health units, and we're also monitoring measles MMR vaccine uptake in our DPH clinics. But we are not actually monitoring the students within that student body who are getting those MMR vaccines. We continue to work with the schools and ask them to encourage their parents to consider that for if they've made a choice at this time for their child not to be vaccinated, but we don't have figures on whether or not that is increasing at this time.
Deidre, go ahead with your question.
Hi, Deidre McPhillips with CNN. I was just wondering if you could offer a little more detail about what your interaction with the CDC has been like. I know you said you're still reporting cases into them, but I was wondering if you've had other communication. HHS mentioned that there's long-term staff in South Carolina. Just curious for more details on that.
Well, we do have CDC assignees to our Department of Public Health, and so those are staff who have been assigned to our health department and have been working with us for quite some time. And they're also assisting with the response to this measles outbreak. We continue to stay in contact with the CDC. We are using some of the resources that they provided for education and clinical guidance and whatnot, and we are reporting our cases to the CDC. So we maintain that connection.
Lauren, did you have a follow-up?
I did not. I'm so sorry. I think the hand just kind of stayed up by accident. I'm not sure how to turn it. Oh, never mind. Sorry.
Quite all right. We've all been there. Debbie, go ahead with yours.
Yeah. Is there any plan or has the state done any sequencing of the strains of measles that you're seeing? And is there any information about if there are any known links to other outbreaks in the US or elsewhere?
We are submitting the clinical samples that have been provided to us to a reference laboratory that does perform sequencing, and we are able to identify potential linkages to what is circulating in other areas of the country. And when we get better verification on the specificity of potential sources, and if there are differences in the genetic makeup of any of these strains, then we would be able to report out. But at this time, we have preliminary information on that sequencing, but we are looking into those associations with transmission elsewhere in the country.
Thank you. Tom.
Hey, Tom Corum, Post and Courier. So do we know at this point, are all 23 of South Carolina's cases unvaccinated? And is there any, can you identify the Spartanburg business where the other two cases occurred, or tell us what kind of business it was?
Yeah, so to our knowledge, all of our current cases have been unvaccinated. And we make notification about businesses or facilities involved when we have a need to warn the public of potential exposures, and we have not been able to notify all those who may have been exposed, as I previously explained. But for that particular business, we have identified that there were no public exposures. And so for that reason, we don't need to identify the business because there was no public exposures that occurred there.
Okay.
Ray, go with the question.
Hey there, Ray from Channel 4 again. Because you all have only gotten 7 doses of the MMR vaccine in the mobile health units in the week that you all have started this, does that put a damper or lessen the amount of stops that the truck is going to be making throughout Spartanburg County as this outbreak continues?
I'm sorry, could you repeat your question? I want to make sure I understand exactly what you're asking about the mobile unit moving around.
Yes, ma'am. Because your initial turnout, you said you had 7 doses of the MMR vaccine in the mobile health units so far. I'm just wondering, does that cause DPH to kind of rethink how often it deploys, or is DPH going to continue deploying on its current plan and not reduce the number of stops that the mobile truck is visiting just due to the low turnout?
Thank you. And sorry, I misunderstood when you said about the number of stops. And what we're doing with our mobile health units is that we are continuing to evaluate the uptake through that service and modify that in an effort to make it more accessible. So things that we're evaluating are the hours that it's available. If that's not convenient to everyone, we may expand the hours of availability. The other thing that we're evaluating is whether it's more useful to have that, even though it's a mobile health unit, it's not that it moves around per se. We select a location, we make notice of the location and the hours it will be operating at that particular location. And what we're looking at is if it might be more helpful to these impacted communities is to have that mobile unit set up in a particular space at a particular time on a more regular basis so that they can recognize that as a potential ongoing resource that they can take advantage of if they couldn't take advantage of it on a particular day. So the answer is yes, we do continue to evaluate how well that's working for our community members, and we'll modify that service as needed to improve access as much as we can.
Thank you for that question. Lauren, go ahead.
Hi, Lauren Miller with WSPA again. I wanted to ask, with the expansion of that and the kind of disappointing number of people coming to that mobile unit, is there a large concern that more cases have not come forward?
A large concern that more measles cases have not come forward?
Correct.
So we continue to be concerned that additional cases will pop up in our communities because of our declining immunization coverage. And for this reason, we continue to reinforce the message of the benefits of the measles vaccine in preventing that ongoing spread. And I also should have mentioned that for the mobile service that we're providing, we're also attempting to get input from the community members about what might work best for them. And so these are just additional efforts in our hopes to increase the uptake of the vaccine, because we remain concerned that additional cases may occur. And we know that measles vaccination is the most successful tool in preventing that spread.
Thank you for that question. Baker, go ahead with your question, sir.
Has Department of Health done any particular outreach with any specific immigrant or religious groups in Spartanburg County to try to break through any skepticism about, or direct resistance to vaccinations, and interested to know how that effort might be going?
So our efforts are to broadly reach out to this particular community across demographics and cultural entities, to make sure that we're reaching everyone, because we are concerned that there can be transmission in this community and expose anyone who's not vaccinated. We're working closely with our community outreach workers, our DPH community outreach workers, our community health workers, our health educators, and our community partners to help us get those messages to all communities, particularly in the upstate area, through the faith community, through schools, through community-based organizations. So we want our message about the threat of exposure to be far-reaching, because the virus can reach anyone, and that is what we want to prevent. And we want to make sure everyone is aware of the risk and that everyone has the information they need to be protected.
Great, you have a follow-up question.
Yeah, I'm just wondering, Dr. Bell, how are you all able to connect the Greenville case to the ongoing Spartanburg County outbreak?
So we have not established any connection to that Greenville, from that Greenville case to the Spartanburg cases. But we are considering that as part of the outbreak because of community transmission. We are now in South Carolina experiencing an outbreak, and we may not be able to track the source of all cases. This just tells us that there's unrecognized community transmission, that cases may pop up like this, and we won't necessarily be able to track them all back to those sources in Spartanburg, but we are counting them as part of the outbreak.
Does anybody have any further questions for Dr. Bell? Yeah, Tom, go ahead, sir.
So I think you've said in the past that, the virus doesn't respect political boundaries. Have you had any communication with other states? I think in particular, North Carolina has yet to see a measles case about the outbreak going on here and whether there are concerns about that spreading to other geographic areas like North Carolina.
Well, we know that we've had inquiries from North Carolina about our outbreak here, so we know that they are aware. We have not been able to, I'm not aware of any cases in North Carolina that are in any way related to the outbreak that we're seeing in Spartanburg.
Okay. Actually, I don't think North Carolina has any cases.
At this time, I believe they've reported some in the past, but I'm not aware of any active investigations of measles in North Carolina at this time.
Thank you.
Thank you. Baker, go ahead, sir.
Yeah, just one more. My understanding, if I read y'all's data correctly, is that the Global Academy School has only a 17% vaccination rate for MMR. Again, kind of following up on, the specific outreach. I know you're talking with people at that school, but, like how strong is the push there? And related to that, I don't know much about how diseases spread and specifically measles, but, has there been any modeling done or any way to kind of get an estimate of what risk a school like that is at? I mean, if it has 450 or more kids in the same building every day, unvaccinated, what are they looking at?
Well, we've been in communication with the involved schools, and they are aware of their vaccination coverage. And we want to make clear that this is not the school's decisions about this, that this is the parents' decisions. The schools do not necessarily have control over the choices the parents are making, but we are, continue to ask the schools to work with us in communicating the risk to their parents to help reinforce our messaging about the risk. And so we are grateful for the collaboration that we're having with the schools and continue to ask for their support in communicating that risk of having a low vaccinations rate within their particular settings. Excuse me. We have mentioned before that this varies from school to school.
Thank you for that question.
Yes, thank you.
Spectrum, let's see a question.
Hi, this is Julia Johnson with Spectrum News, South Carolina. I wanted to ask what the communication or work with federal partners has been like. Is there any advising from the Department of Health and Human Services? What's going on, I guess, in that area?
Our communications and engagement are with those staff with the measles response at the Centers for Disease Control and Prevention at the CDC.
Any follow-up?
I guess what kind of guidance have they given other than just promoting the vaccine, or is that the extent of it?
Well, we have, there are abundant resources from the CDC because of the vast knowledge that they have about measles transmission historically. We are benefiting from those resources available through their website. We have been in contact with the subject matter experts at CDC related to measles transmission and prevention. And we are reporting our cases to the CDC. So we are engaged with them by using their resources through teleconferences and benefiting from the resources that I've mentioned.
Thank you for that question. Do we have any further questions for Dr. Bell today? Right. Seeing none, I want to thank everyone for their time today, their participation in this weekly briefing. We appreciate, again, your understanding of our timelines. Our scheduled update session is Tuesday at noon and Fridays at noon for new case counts or any new information. Should any kind of breaking news or situation arise, we'll certainly step in and let you all know immediately. But we appreciate you as our valued media partners. A copy of this briefing will be available on our YouTube page this afternoon, and will also go onto our measles outbreak page that Dr. Bell referenced earlier. Thank you so much for your time. Thank you, Dr. Bell, for your expertise and your time, and we will talk to you soon. Take care.